In this video, we will discuss central cord syndrome, tracts involved in this syndrome, and the effects produced due to the defects in these tracts. The central cord syndrome occurs due to hyperextension of the neck. Anterior cord syndrome occurs due to hyperflexion of the neck, but this one is due to hyperextension of the neck. So what are the conditions that cause acute hyperextension of the neck? The motor vehicle accident and sudden fall, they may cause hyperextension of the neck, and is caused due to chin hitting a hard surface, such as occur in motor vehicle accident. Sudden braking of the vehicle causes hyperextension of the neck. More common causes of central cord syndrome are syringomyelia and osteoporosis in old age, and also tumor. The loss of motor and sensory function is more in upper limb and more in distal muscles than in the proximal muscle. So which tracts are involved? Corticospinal, the descending tract, and spinothalamic, the ascending tracts, are affected. Anterior horn cells are also affected, and they produce lower motor neuron type of lesion, that is flexidity, atrophy, atonia, and areflexia. The lateral corticospinal tract damage produces upper motor type neuronal lesion, the spasticity, hypertonia, hyperreflexia, and a positive Babinski sign. The lateral corticospinal tract run ipsilaterally at the spinal cord level. Lateral corticospinal tract, that is, starts from the motor cortex, they decussate in the medulla, in the pyramid, and they cross over to the opposite side and then into the spinal cord. So in the spinal cord they run ipsilaterally. And how about the sensory loss? A sensory loss is a dissociated sensory loss. Why? Because it affects the spinothalamic tract, whereas the dorsal column, which are posteriorly, they are not affected. It spares the vibration and position sense which are carried by the dorsal column. The lateral spinothalamic tract crossover in the spinal cord, one or two level above the lesion, and they run contralaterally. So a defect in lateral spinothalamic tract which cross over in the spinal cord will produce defect on the opposite side of the body. Lateral spinothalamic tract carries the pain and temperature fibers, while clinical features are more in upper limb than in the lower limb. Since the central cord syndrome affects both sides of the spinal cord, so the condition is bilateral. Cervical portion of both the descending lateral corticospinal tract and the ascending lateral spinothalamic tract are more medial compared to the sacral region in both these tracts. So in this central cord syndrome, upper limb is affected more than the lower limb, and the weakness is more in this upper limb, see here, and then compared to the thorax and the lower limb. The condition occurs in old people with osteocytes, and there is usually sacral sensory sparing in this condition.